Ever wondered why your baby's diaper is always full? It's a question that has puzzled many a new parent, often leading to a frantic Google search in the wee hours of the morning. Welcome to the world of infant diarrhea, a common occurrence that's as unpredictable as a game of Russian roulette, only with a lot more mess involved. Picture this. You're a new parent, just getting the hang of this whole keeping a tiny human alive thing. Your baby is cooing, you're cooing back, everything's going smoothly. Then suddenly, you're hit with the dreaded smell. You open the diaper and it's like a scene from a horror movie. Now, your initial reaction might be panic. Oh no, my baby's got the runs, you think, your mind immediately jumping to all the worst-case scenarios. Or perhaps you're in the denial camp. This can't be normal, you insist, convinced that your baby is the first in history to produce such a, well, impressive amount of poop. But here's the thing about babies. They poop. A lot. And sometimes it's runny. It might even be a different color or, brace yourself, have a bit of a smell. But before you start dialing the pediatrician's number, take a deep breath. Remember, this is all part of the joy of parenthood. And trust me, every parent has been there, knee-deep in diapers, wondering if it's normal for something so small to produce so much. Well, you get the picture. So if you think it's a code brown situation every time, let me tell you, you are not alone. Welcome to the club. The diaper dilemma is real and it's a rite of passage for all new parents. So buckle up, because we're about to dive deep into the world of infant diarrhea. It's going to be a wild ride, but don't worry, we're in this together. Now, what exactly is infant diarrhea and why does it seem like a never-ending saga? Let's dive in. Infant diarrhea is characterized by frequent, watery, and unusually loose stools. It's not just about the number of diaper changes, but also the consistency and volume that matters. Now don't get all grossed out, we're talking science here. But what causes this messy situation? The common culprits are often viral infections like the respiratory virus RSV or dietary changes. Yes, even the smallest changes in your little one's diet can send their tiny tummies into a tizzy. For instance, the introduction of new foods and at times, certain formulas or breast milk if the mother has eaten certain foods, can lead to diarrhea. Now imagine our new parent from the previous scene frantically Googling, "Why is my baby's poop so runny?" And voila! They learn about these common triggers. There's a sense of relief because now they know it's not an alien invasion causing the diaper drama, but rather common factors that can be managed with guidance from a healthcare professional. But it's not all doom and gloom. This process, albeit messy, is often the body's way of expelling something it doesn't quite agree with. It's like your baby's system saying, "Hey, this doesn't sit right with me," so out it goes. However, it's not just about understanding what's causing the diarrhea, but also about knowing when it's more than just a simple tummy upset. That is why it's crucial to keep track of any accompanying symptoms like fever, vomiting, or poor sleep, which could indicate a more severe condition. So, it turns out, those cute little munchkins are not just poop factories after all. They are incredibly complex little beings, constantly interacting with their environment, and sometimes, that interaction results in a messy diaper. But hey, that's all part of the wonderful and slightly smelly journey of parenthood. But when does the poop alarm go from a soft chime to a blaring siren? That's the question many parents find themselves asking when dealing with a case of infant diarrhea. So let's dive right into it. A few loose stools here and there might just be a sign of a developing digestive system. But if you're changing wet, runny diapers more often than you're changing your own clothes, it might be time to consult a pediatrician. Watch out for signs of severe diarrhea. These could include stools that are watery, bloody, or have a foul smell that would make even a skunk cringe. If your baby is passing more than 8 stools a day, and this continues for more than a week, then it's probably time to ring that alarm bell. Now let's imagine a scenario. You're a parent and your little one has been having diarrhea for a few days. You've noticed they're also unusually fussy, refusing to eat, and have a fever. It's also been a struggle to keep them hydrated, and they've been having fewer wet diapers than usual. These are all signs that your baby's body is under stress, and it's time to seek medical attention. Remember, severe diarrhea can lead to dehydration, which is a serious concern for infants. Look out for signs of dehydration. These may include a dry mouth, crying without tears, a sunken soft spot on the head, or sleepiness and irritability. It's also important to keep in mind that while most cases of diarrhea are due to common infections, there are other serious causes like allergies or underlying conditions. So if your baby's diarrhea is accompanied by other worrying symptoms like a rash, breathing difficulties, or prolonged vomiting, don't hesitate to call a doctor. And remember, if your baby's poop starts looking like a modern art masterpiece, it might be time to call the doc. It's always better to be safe than sorry when it comes to the health of your little one. After all, their well-being is no joking matter, even if we are talking about poop. So you've got a baby with a case of the runs. What's next? Well, let's dive into the nitty-gritty of managing this messy situation. The first and foremost step is to ensure your little one is staying hydrated. Diarrhea can quickly lead to dehydration in infants, which can be quite serious. So how can you keep them hydrated? If your baby is still breastfeeding or formula feeding, continue to give them their regular feeds. You might even want to increase the frequency slightly. For older infants who've started on solids, you can also offer small sips of water in between their feeds. Now let's move on to the second part of our battle strategy, the diaper duty. With diarrhea, diaper changes are going to be more frequent. Make sure you're well stocked and prepared for some extra laundry. It's essential to change your baby's diaper promptly after they've had a bowel movement to prevent diaper rash. And remember, gentle cleaning and a good barrier cream can be your best friends during this time. As our parent character embarks on this challenging journey, they put these strategies into action. They ensure the baby is well hydrated and they're changing diapers like a pro. It's like they've found their rhythm amidst the chaos. And guess what? They start to notice an improvement. The frequency of the bowel movements begins to reduce, and the baby seems more comfortable. It's like a ray of sunshine breaking through the stormy clouds. But remember, while these home remedies can be helpful, it's always crucial to consult your pediatrician. They can provide the right advice based on your baby's specific needs and symptoms. And of course, if your baby's condition worsens or they show signs of severe dehydration, like fewer wet diapers, dry mouth, or excessive sleepiness, it's time to seek medical attention immediately. So, our brave parent sails through the poop storm armed with hydration and a whole lot of diapers. They've shown that with the right information and a dash of determination, handling a situation like infant diarrhea can be less daunting than it might initially seem. All right, it's time to wrap up our journey down diaper lane. We've had quite the adventure, haven't we? First, we unraveled the diaper dilemma and understood that infant diarrhea is more common than we think. It's not always a cause for alarm, but a way for our baby's body to react to changes in diet, teething, or even a minor infection. Next, we delved into the what and why of infant diarrhea. We learned that it's not just about runny, watery stools. There's more to it. Frequency, color, and consistency also play a part. We also discovered that while we might be quick to blame the last meal, there could be various other reasons behind it, from viruses to allergies, and sometimes it's just a part of growing up. In the When to Worry chapter, we understood that while most cases of diarrhea are not severe, there are certain red flags we need to watch out for. High fever, blood or mucus in the stool, signs of dehydration or diarrhea that lasts more than a few days. These are all instances when we should seek medical advice immediately. Then, we learned how to handle the situation. We understood the importance of keeping our little ones hydrated, making small changes in their diet, and when necessary, seeking help from our trusted pediatrician. We also learned that we're not alone in this. From Seattle to Sydney, parents are dealing with the same messy issues. And now, as we wrap up this poop talk, let's remember that as parents, we're doing a great job. We're constantly learning, adapting, and doing our best for our babies. Diarrhea is just a small bump in the road in this incredible journey of parenthood. And that, folks, is the crappy truth about infant diarrhea. Remember, every diaper tells a story, and it's not always a stinky one.